Quick question, when you get a nosebleed, do you tilt your head back? If you said yes, you are doing it all wrong and it could actually be very dangerous. I'm Ronald from HP Clinic, and today I'm going to show you the exact and correct way to stop a nosebleed in a jiffy. This is the exact way we do it here in the clinic. So here is what most people do. They tilt their head back while facing the ceiling, thinking that this will stop the bleed. But let me tell you something, this is very dangerous, and here is why it is very dangerous, okay? Tilting your head back does not stop the bleeding, alright? Instead, it just flows right into your throat. You can swallow this blood, which in turn will make you nauseous. It can also make you vomit, and in serious cases, it can even choke you. Alright, now let me show you the right way. I want you to follow along with me for this proper technique. And technique number one, you have to sit upright. Alright, so once you sit upright, then you lean forward. That is technique number one. Leaning forward allows the blood to flow out, alright, reducing the risk of vomiting and choking while swallowing the blood. Technique number two, I want you to pinch your nose, the soft part of the nose. Here is the bony ridge, and then towards the end we have the soft part of the nose. Okay, so what I want you to remember is that I want you to pinch it firmly closed, but not too hard that it hurts, just firm enough to apply some pressure. Technique number three is to hold for 10 minutes. This is where people get it wrong. You may notice that blood will stop coming out after maybe a minute or two, but do not stop to check if it stopped completely. Continue pinching for about 10 minutes, alright? As you do this, breathe through your mouth. These 10 minutes gives your blood enough time to clot, and because the clot is very vulnerable, you need to hold on. Do not give up too quickly, alright? If you give up too quickly, the clot will just break down and the bleeding continues. So hold on for about 10 minutes as you breathe through your mouth. Set up timer on your phone or on your wristwatch if you have one, and then wait patiently. So the next step is release very gently after about 10 minutes of holding on. Do not blow your nose. Do not pick it. Sometimes it might be too sweet. You want to pick on it. Then do not bend over. After you do this for about 10 minutes, I want you to just sit upright quietly. This is when the clot is still very fragile. The science behind it is that your nose has a lot of tiny blood vessels. The plexus is called the Hasselbalch's plexus. So if one of them breaks, you get a nosebleed. When you pinch the soft part of your nose, you apply direct pressure to these blood vessels, enhancing the clot and then stopping the bleed. What causes nosebleeds in the first place? I believe that if you know, you might try next time to prevent some that are preventable. Dry hair. So this is the most common cause. When the air is dry, the lining of your nose dries out and then cracks, predisposing these fragile blood vessels to breakage and then leading to a nosebleed. This is why nosebleeds are very common in dry seasons or where it is hot, like in Kenya, for example, or where somebody uses air conditioning a lot. Number two is nose picking. It is embarrassing to talk about it, but it's true. So picking your nose constantly damages those delicate blood vessels. Next one is allergies and colds. So when you are having allergies or constant colds, then you blow your nose pretty frequently, and when you do this, the fragile blood vessels are irritated most of the time, and then they can break, leading to a nosebleed. Okay, and then the inflammation also makes them more fragile. Alright, so the next cause is injury. Getting it in the nose, even lightly, or even bumping it accidentally, can predispose you to a nosebleed. Another cause is medication. Most likely if you are on blood thinners like warfarin or aspirin, they make you bleed more easily. So you should be aware when you're using these medications, and maybe if you are having something like allergies or colds, you might get a nosebleed. And this is very important because you can bleed a lot when you are on these medications. Blood pressure. That nosebleed will not go away. When that blood pressure will go down is when that nosebleed will stop. Quickly find how you can find your way to a nearest facility so that you can get checked. How to prevent the most common causes of nosebleeds? Keep your nose moist. You can use saline nasal drops if you are in arid places or where it is very hot, or if you constantly use air conditioning. Number two, you can use a humidifier. Humidifier will make the air around you moist. Another one, do not pick your nose. Don't pick your nose. You can blow it very gently one side and then another side, and then stay hydrated. When you stay hydrated, the mucous membrane will be hydrated. Most nosebleeds are very harmless, and they stop with the technique I just showed you, but see a doctor if in 20 20 minutes of proper applying pressure, the nosebleed does not stop. If you get frequent nosebleeds, maybe more than once a week, if the bleeding is heavy and you're swallowing a lot of blood, if you feel dizzy and faint from blood loss, if the nosebleed began after a head injury, if you are on blood thinners like aspirin, warfarin, and you are getting frequent nosebleeds, if you have other symptoms like bleeding gums, maybe you chew on a banana and you see that there's some blood on the banana, you need to see a doctor. So remember, sit upright, lean forward, pinch on the soft part of the nose for 10 minutes and then sit quietly for another 10 minutes. Do not blow your nose too hard. Do not pick it, alright? Just sit quietly and wait. So I'm Ronald and this is HP Clinic. If this helped you, remember to like the video, subscribe, and strike the notification bell so that you don't miss the next episodes.